So good morning to all of you. Good morning to all of you and welcome to this must know series of MCQ for the FMGE students. I am Dr Pradeep Pawar, Professor of Anatomy. I've got a vast experience of teaching anatomy for the undergraduates, the postgraduate students as well as the entrance examinations. Okay, so students, we'll start with the first MCQ. Have a look here. Identify this pointed structure. Good morning, good morning. Identify this pointed structure. I hope the field is clear to you. Okay, plenty of things in this visual slides. Plenty of things. So let us understand one by one. What is this pointed structure? Anyone? Come on. You can guess, students. You can guess. No problem. You can guess. What is this area? What is this area that you will be looking at? Inferior alveolar. No, it's not inferior alveolar nerve. Anything else? It's not inferior. Good that you've answered, Kirti. Good. Try, students, you always try, so that if you make a mistake, you will always remember this. This is not inferior alveolar. Why? I'll tell you. The inferior alveolar nerve enters the ramus of the mandible. There's a foramen in the ramus of the mandible named the mandibular foramen, and the inferior alveolar nerve enters into the mandibular foramen along with the inferior alveolar vessels. Okay, so that will be in the mandible. Yeah, now this is deeper. This is a deeper structure. So see, if you can just try to visualize this slide and tell me what is this that I'm pointing out. Ye kya hota hai? This is the pterygoid plate. Pterygoid plate, that's at the base of the skull. At the base of the skull, this plate is the pterygoid plate. This is the mandible. Okay, pterygoid plate, mandible. What do you call this pointed structure as? Anyone? Anyone? What is this line known as? What is that line? Femoral nerve nahi hai bacha. This is not femoral nerve. This is the head and neck region. Head and neck hai ye. Ye lower limb nahi hai. Get oriented to the slide first. Huh? Good. You make mistakes. You will always remember. This is the slide of head and neck. This part. Ye part hai ye. This is the part. Okay. Yes. Very good. So this is the pterygoid plate. Yes. This is the pterygoid plate. That's the mandible. And this raphe. Ye jo line aap dekh rahe ho. This is what we call as the pterygomandibular raphe. Excellent. Pterygomandibular raphe. And why is this so important? Why is this so important? This pterygomandibular raphe gives origin to two muscles. Students, this pterygomandibular raphe gives origin to two muscles. One is this and the second one is this. If you can just identify what is number 1 and what is number 2. This is very important. This is very important slide. What is 1 and what is 2? Two muscles arise from the pterygomandibular raphe. Ek aage arise hota hai. One arises anteriorly and one goes posteriorly. So which is the one which goes anteriorly? A muscle which is known as a whistling muscle. Whistling muscle. Who's that? Guess, guess, guess. That's okay. Guess. Whistling muscle. Buccinator. Very good, Kirti. That's buccinator. So number 1 is going to be the buccinator, and number 2 is a muscle of the pharynx. It's a circular muscles of the pharynx. You know, students, the circular muscles of the pharynx are known as constrictors. Constrictors. There are 3 constrictors, bacha. There are 3 constrictors. One is the superior constrictor, one is the middle constrictor, and one is the inferior constrictor. Okay. So there are 3 muscles of mastication. So which is this muscle? Which is this muscle? Buccinator is not a muscle of mastication, bacha. Buccinator is a muscle of facial expression. Remember, all of you, buccinator is not a muscle of mastication. Buccinator is a muscle of facial expression. Yes. So this muscle is the superior constrictor. We have got three circular muscles, three constrictor muscles of the pharynx. One is the superior constrictor, one is middle, and one is inferior constrictor, correct? So which muscle is this? This is the superior constrictor, the one which arises from the pterygomandibular raphe. Ye clear hai? Is this clear to all of you students? This is a very important visual slide. Remember, this is the pterygoid plate, that's the mandible. This line, this raphe is known as the pterygomandibular raphe, gives origin to the buccinator in front and the superior constrictor muscle behind. Perfect, right. This is the hyoid bone. Ye dekhiye, this is the hyoid bone. And what is this muscle of the pharynx which begins from the hyoid bone? This is what we call as middle constrictor muscle of the pharynx. And this one which begins from the thyroid and iske niche hoga cricoid. What is this constrictor muscle? The inferior constrictor. So clear students, three constrictors: superior constrictor, middle constrictor, inferior constrictor. These are the three constrictor muscles of the pharynx. And remember, if this is one superior constrictor, one starts from this side, one starts from this side, है ना? ऐसे दोनों पीछे जाएंगे, they go back and they interdigitate along the line which is known as median raphe. So students, if this is my one superior constrictor, दोनों sides का, of both the sides, the middle constrictor is going to overlap the superior constrictor, and the middle constrictor will be overlapped by inferior constrictor. Are you following? Like you take one glass, you put it inside the other glass, and you put this within the other glass. मतलब एक के अंदर एक glass जाते हैं. You place one glass inside the other. So how do they overlap? वैसे the constrictor muscles are going to overlap each other. So students, between the superior and middle constrictor gap होता है. Between the middle and inferior constrictor there's a gap, and these are extremely important MCQs for you students. So now this is a nerve. This is a nerve which goes between the superior and the middle constrictor muscles of the pharynx. This is a nerve. Now tell me, कौन है ये? This is a nerve which goes between the superior and the middle constrictor muscles of the pharynx. This nerve. Ab bolo. Tell me. Anyone? You can guess, my dear children. You can guess. Even if it is wrong, it's okay. You are not giving an exam. So always try to guess. Glossopharyngeal nerve. Very good. So this is the glossopharyngeal nerve. Glossopharyngeal nerve. Yes. And look, there is only one muscle which the glossopharyngeal nerve is going to supply. Anyone? There's only one muscle which the glossopharyngeal nerve is going to supply. Which is that muscle? कोई बोल सकता है? The muscle which is supplied by the glossopharyngeal nerve. एक ही muscle होता है. And the name of the muscle is Stylopharyngeus. Stylopharyngeus. Perfect. Very good. So structures passing between the superior, I'll write it for you, superior and the middle constrictors. Superior and the middle constrictors. Structures passing between the superior and middle constrictor muscles of the pharynx. One is the glossopharyngeal nerve and second is the stylopharyngeus muscle. Now that you've told me stylopharyngeus muscle, something else can I ask you? This stylopharyngeus muscle, students, this stylopharyngeus muscle is a muscle of which pharyngeal arch? Anyone? ऐसा ना, there's a chain which goes on. You keep on answering, I'll keep on asking you, and many of the things will get clear to you. Which is that stylopharyngeus muscle is derived from which pharyngeal arch? Third. Excellent. Very good. Third pharyngeal arch. And which is the nerve of the third pharyngeal arch? The nerve of the third pharyngeal arch is glossopharyngeal nerve, and that is how glossopharyngeal nerve is going to supply the stylopharyngeus muscle. Perfect. Glossopharyngeal nerve supplies the stylopharyngeus because it is derived from third pharyngeal arch. So ये MCQ clear है? Structure which goes between the superior and the middle constrictor muscles of the pharynx is one, the glossopharyngeal nerve, and second, the stylopharyngeus muscle. Stylopharyngeus. Perfect. Okay. Coming back to this slide. Coming back to our slide. Yep. So what is this now? What is this muscle? This is the superior constrictor. ये है ना, ये superior constrictor muscles है. And now students tell me, all the muscles of the pharynx from inside are covered by a fascia. Can anyone answer this? All the muscles of the pharynx from inside are covered by a fascia, and all the muscles of the pharynx from outside are covered by a fascia. Yes, ab bolo. Which is the fascia which covers the muscles of the pharynx from inside? From inside. Anyone? Which is the fascia which covers the pharynx from inside? Investing nahi bacha. Investing nahi. Investing nahi. Investing is something totally different. I'll tell you this later. From inside, from inside the muscles are covered by pharyngobasilar fascia. Pharyngobasilar fascia uska naam. All the muscles of the pharynx from inside are covered by pharyngobasilar fascia, and from outside they are covered by buccopharyngeal fascia. Buccopharyngeal fascia. This should be perfect. This is very important. ये clear है? Muscles of the pharynx. You can write this down. Muscles of the pharynx from inside are covered by. Yes, muscles of the pharynx from inside are lined by. You can write this. I'm not writing this. Muscles of the pharynx from inside are lined by pharyngobasilar fascia. Pharyngobasilar fascia. And muscles of the pharynx from outside. From outside, it's buccopharyngeal fascia. From outside, buccopharyngeal fascia. ठीक है? Perfect. Okay, very good. Now you see, students, about the superior constrictor, matlab about the superior constrictor and the base of the skull, there's a gap here, and this gap is closed by a fascia. You can see this white colored fascia which covers the pharynx from inside, and that is the pharyngobasilar fascia. Matlab between the superior constrictor and the base of the skull, there's a gap here. There's a gap. Anyone, can you tell me what is the name of the space? Matlab above the superior constrictor or between the superior constrictor and the skull, there's a gap, there's a space. What is the name of the space? Anyone? Anyone? Very good, Kirti. That's the foramen of Morgagni. Foramen of Morgagni. And this foramen of Morgagni is closed by the pharyngobasilar fascia. It is closed by pharyngobasilar fascia. I'll just tell you this. So, between the superior constrictor, I'll write it in shorter, between the superior constrictor and the base of skull, this is what we call as the sinus of Morgagni. Sinus of Morgagni. It is closed by pharyngobasilar fascia. It is closed by the pharyngobasilar fascia. Okay. Now, what are the structures passing through it? Another very important MCQ. Structures passing through it. Structures passing through it. Chalo, start. 1. Anyone? Very good. 1 is the eustachian tube. Eustachian tube or the auditory tube. This you have to know. ये बहुत important MCQ है. Structures passing above the superior constrictor or structures passing between the superior constrictor and the base of the skull. 1 is the eustachian tube. 2nd is the levator palatii muscle. Levator palatii muscle. 3rd is the ascending palatine artery. Ascending palatine artery. Anyone? Ascending palatine artery is a branch of what? Branch of. Chalo, students, answer this. Ascending palatine artery is a branch of. Yes, Kirti, answer. Ascending palatine artery is a branch of what? Yes, the others also answer. It's a branch of. No, it's a branch of facial. Ascending palatine is a branch of facial. It's a branch of facial. And 4th, palatine branches of palatine branches of ascending pharyngeal artery. Palatine branches of ascending pharyngeal, and this ascending pharyngeal artery is a branch of, ascending pharyngeal artery is a branch of external carotid. Ascending pharyngeal is a branch of external carotid. So that's it. So structures passing through the sinus of Morgagni. 1. Eustachian tube. 2nd. The levator palatii muscle. 3rd. Ascending palatine artery. And 4th. Palatine branches of ascending pharyngeal artery. Perfect, perfect, perfect. Okay, I'll just finish this. I've started this topic. I'll finish this and then we'll proceed to the next MCQ. You clear the structure? Students, what did I tell you? There are 3 constrictor muscles of the pharynx: superior, middle, inferior, and there are gaps between the constrictors, and there are structures which go between the constrictor muscles. Above the superior constrictor, 4 structure goes. Between the superior and the middle constrictor goes the glossopharyngeal nerve and the stylopharyngeus muscle. Okay. Is this clear? If it's clear, just put a thumbs up so I'll proceed forwards. If it's clear. Agar clear nahi hai to students, please ask me. Okay, fine. The rest of you. Now just 2 more things left. What passes between the... Okay, good, 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 good. So between the middle and the inferior constrictor, between the middle and the inferior constrictor, what passes? Okay, okay. Between the middle and inferior constrictor. This is another very important MCQ. ये जो मैं बोल रहा हूँ आपको, this is extremely important, students. You should know this. You should know. Between the middle and the inferior constrictor, anyone, what passes? 1. The nerves which are going to supply the larynx, they will go through this. Which are the nerves supplying the larynx? Agar aapko pata hai, you will understand what are the structures. 1 is the internal laryngeal nerve, and the second one is the recurrent laryngeal nerve. These are the 2 nerves which are going to supply the larynx, right? Clear? The internal laryngeal nerve supplies the larynx, sensory supply to the larynx above the vocal folds. We know this. The internal laryngeal nerve supplies the sensory supply to the larynx above the vocal folds, and the recurrent laryngeal nerve supplies the larynx below the vocal folds, right? So these 2 nerves have to go to the larynx. So they first go into the pharynx and then they go into the larynx. So between the middle and the inferior constrictor goes what? Yes, very good, very good. It goes what? 1 is the internal laryngeal nerve, internal laryngeal nerve, and second is the superior laryngeal vessels. External नहीं, external laryngeal बाहर होता है. External laryngeal supplies only one muscle, that's cricothyroid. वो बाहर ही होता है. So which are the nerves which have to go inside the larynx? 1, internal laryngeal nerve, and second is the recurrent laryngeal nerve. ठीक है? So how do they go in? Between the middle and the inferior constrictor, ये 2 चीजें जाते हैं, and below the inferior constrictor. Below the inferior constrictor, what goes is the... Arey Ankit, very good. Excellent. Congratulations. Congratulations, bacha. Congrats. Okay. Below the inferior constrictor goes 1 recurrent laryngeal nerve, recurrent laryngeal nerve. All your efforts, bacha. All your efforts. Very good. Nice to hear this. Heartiest congratulations to you. Recurrent laryngeal nerve and inferior laryngeal vessels. Okay? Sure. Great. So these are the structures which pass between the constrictors. So this is what you are supposed to know. Extremely important MCQs, huh? Extremely important. I hope this is clear. So later somewhere when we are discussing the pharynx and the larynx, will again come to this MCQ, students. Again you will get an orientation to this. Fine. So that's it. Now coming back to our slide, have a look. Plenty of things in this one slide. If you know your concept well, if you know your theory well, you will be able to answer everything in the slide. I'll come back to the slide. Yes. Right. Now see this once again. Coming back to the slide. Okay. Now students, can anyone tell me what is this bone here? देखो हम बहुत चीजें इसमें, just try to understand this. What is this structure here? Answer this. You can see now बच्चों, you can see this now, or I should magnify this for you. I'll magnify this. एक मिनट देखता हूँ if I can magnify. Okay, that's nice. चलो 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 बच्चों, tell me what is this structure? I've magnified this for you. You just keep on answering. I'll keep on asking. You keep on answering. Very good. That's a styloid bone. It's a styloid bone. And this styloid bone is developed in which pharyngeal arch? Anyone? The styloid. Very good. The styloid bone is developed in which pharyngeal arch? Styloid process, or you say styloid process. This is a part of temporal bone. Styloid process. It is developed in which pharyngeal arch? Everything beginning from S is derived from which pharyngeal arch? Anyone? Everything beginning from S, second pharyngeal arch. Very good, very good. Everything beginning from S, बच्चों, मतलब the lesser wing, the smaller corner of the hyoid bone, the styloid process, the stylohyoid ligament, है ना? All the structures are derived from the stapedius. This is derived from the second pharyngeal arch. And students, if you can quickly tell me the structures attached to the styloid process. Okay, anyone? Structures attached to the styloid process. Can anyone tell me this? Structures attached to the styloid process. One. Chalo, bolo fast. Structures attached to the styloid process. Another extremely important thing for you. Extremely important. Structures attached to the styloid process. Styloid process. Huh? Yes. There will be two things. एक तो muscles होंगे and दूसरे ligaments होते हैं. एक तो muscles होते हैं and दूसरे ligaments होते हैं. Yeah, we'll start with the muscles. One, stylopharyngeus muscle. This is a very important thing. Stylopharyngeus muscle. Second, क्या लिखा? Styloglossus. Very good. Styloglossus. Yes, styloglossus muscle. And तीसरा क्या लिखा आपने? Anything else? Stylohyoid. Excellent. Very good. Very good, bachcho. Very good. So, muscles attached to the styloid process. One is the stylopharyngeus. Second is the styloglossus. And third is the stylohyoid. If you can quickly tell me what is the nerve supply of this muscle? Stylopharyngeus. We just discussed this. Abhi dekha humne. What is the nerve supply of stylopharyngeus? Bachcho. What is the nerve supply of stylopharyngeus? We've just seen this. That's the glossopharyngeal nerve. Glossopharyngeal. And why does glossopharyngeal nerve supply the stylopharyngeus? Because both of them are derived from the same pharyngeal arch. That's number three. Number three. The glossopharyngeal nerve and the stylopharyngeus both are derived from the same pharyngeal arch. Perfect. Perfect. Nerve supply of styloglossus. Anyone? Nerve supply of styloglossus, students. Styloglossus. Styloglossus. Bolo. 12th nerve. Excellent. Styloglossus is a muscle of the tongue, right? So it is supplied by the 12th nerve. I can ask you something here. All the muscles of the tongue are supplied by hypoglossal nerve except, come on students, all the muscles of the tongue are supplied by the hypoglossal nerve except. You should know this. All the muscles of the tongue are supplied by hypoglossal nerve except. Anyone? Guess, bachcho, guess. That's okay, you can guess. And even if it is wrong, do not retract the messages. Chalega. No one is going to ask you. Palatoglossus. Palatoglossus, bacha, palatoglossus. Very good. Except palatoglossus. Yes, so all the muscles of the tongue are supplied by the hypoglossal nerve except palatoglossus. Yes. So nerve supply of stylopharyngeus, glossopharyngeal. Nerve supply of styloglossus is the hypoglossal nerve, and nerve supply of stylohyoid. Anyone? Nerve supply of stylohyoid. Bolo. Nerve supply of stylohyoid. Facial nerve. Very good. Facial nerve. Excellent. Facial hai bacha. Facial nerve. And remember students, the moment I see stylohyoid, there is always a muscle with the stylohyoid. मतलब stylohyoid के साथ हमेशा एक muscle होता है. If you can just tell me what is the name of the muscle. There's one muscle always going with the stylohyoid, and both these muscles are supplied by the same nerve. Both these muscles are derived from the same pharyngeal arch. कौन होगा? Stylohyoid and answer. Stylohyoid and. These are must know MCQs. These are must know things for you. Yes, stylohyoid. Anyone guess? बच्चों guess. Come on, guess करो. Two muscles derived from the second pharyngeal arch. अभी I am giving you a hint now. Both are supplied by facial nerve. Two muscles are derived from the same pharyngeal arch. Both are supplied by the same nerve, that's facial nerve, and both are very close friends. एक stylohyoid है, दूसरा कौन है? बोल सकते हो दूसरा कौन है? Yes, the posterior belly of digastric. Posterior belly of digastric. This I'll show you somewhere else in some other slide. But the stylohyoid and the posterior belly of digastric are derived from the same pharyngeal arch. Both will be supplied by facial nerve. Facial nerve. It's the posterior belly of digastric and stylohyoid. Ligaments बोलिए. Ligaments. One is the stylomandibular ligament and the stylohyoid ligament. Stylomandibular, stylohyoid ligament. I hope this is clear. And this is what we call as the styloid apparatus. Styloid apparatus. Okay, very good. Chalo, we've been discussing the same slide since a long time. Students will just finish this slide now. If you can quickly tell me. Right. What is this? What is this that I pointed? What is this that I've pointed? मैग्नीफाई करो इसको. बहुत चीजें ये एक स्लाइड में. There are plenty of things in one slide. Try to identify this. This is the stylohyoid ligament. Clear है students? बच्चों clear है? And what is this muscle? ये बोल सकते हो what is this muscle? Anyone? This also starts from the hyoid bone. This also starts from the styloid process and it is going to the tongue. This muscle is going to the tongue. Anyone? What is this? ये stylohyoid ligament है. What is this muscle which begins from the styloid process and goes to the tongue? This is the styloglossus muscle. Styloglossus muscle. Styloglossus. And what is this muscle? ये देखो यहाँ पे कट कर दिया. We've cut this muscle here. We've cut this muscle here. जिसके दो bellies होती है. There are two bellies for this muscle. This is one belly and this is the other belly. कौन होगा ये? Who's this? Okay, I can't draw anything here. That's a posterior belly of digastric. Posterior belly of digastric. And there's a muscle here which begins from the styloid process. There's a muscle here which begins from the styloid process which goes with the posterior belly of digastric. ये देखिए, ये posterior belly of digastric है. I'll just make this for you. This is the posterior belly of digastric. And what is this muscle which goes with the posterior belly of digastric? ये मैं बोल रहा था आपको. The posterior belly of digastric and the stylohyoid. Okay, this is the stylohyoid. Stylohyoid as a split हो जाता है. It splits. And the posterior belly of digastric goes through the split. समझ में आ रही है? Look, this is the posterior belly of digastric. It goes through the split. And what is this now? ये होगा anterior belly of digastric. So what is this muscle? Stylohyoid muscle. That's the posterior belly of digastric. And this is the anterior belly of digastric. I hope this is clear to you. समझ में आएंगे students? Is this clear? Any doubts you have, you tell me. Okay. So once again I'm telling you, the posterior belly of digastric and the stylohyoid muscles, they are always together. They are always together. They are derived from the same pharyngeal arch. That is the second pharyngeal arch. Both of them are supplied by facial nerve. Facial. Just one last thing, bacho. One last thing in the slide. Come on. I mean, there are so many things. I can't just go ahead. I have to tell you this. Must know topics. Must know things. This are must know for you. चलो बच्चों, this is the hyoid bone. This is the thyroid cartilage. Can anyone tell me what is this that I've pointed to? ये क्या मैंने point किया? This is extremely important. Come on. What is this structure that I've pointed? Anyone? Easy है. Hyoid bone, thyroid cartilage. What is that membrane known as? Thyrohyoid membrane. Perfect, bacha, perfect. Thyrohyoid membrane. And look. There's someone piercing this thyrohyoid membrane. ये ना thyroid membrane को कोई pierce करता है. What is the structure piercing the thyroid membrane? This one. Who's piercing the thyroid membrane? This is another very important MCQ. The same internal laryngeal nerve and the superior laryngeal vessels. Internal laryngeal nerve and the superior laryngeal vessels, they pierce the thyrohyoid membrane. Internal laryngeal nerve and the superior laryngeal vessels, they pierce the thyrohyoid membrane. ठीक है बच्चों? Clear to all of you this slide? Okay, that's it. Everything I've explained, सब कुछ मैंने बोला ये slide में जो है वो. But you have to know this. These are very important things. What is this? What is this vein? Can anyone tell me what is this vein? बच्चों बोलो, what is that vein? जुगुलर मत बोलो ना. अब जुगुलर है एक्सटर्नल जुगुलर, इंटरनल जुगुलर, एंटीरियर जुगुलर. Be specific. That's an internal jugular vein. That's the internal jugular vein. And ये क्या artery होगा? That's the internal carotid artery. Internal jugular vein, internal carotid artery. इनके साथ एक nerve होती है. That's a nerve with them. Tell me students, who's that nerve? The internal jugular vein, the internal carotid artery, and there's a nerve with them. Together put in a sheath named the carotid sheath, which is the nerve. Vagus, very good, vagus. So internal jugular vein, internal carotid artery and the vagus nerve, right, together put in this carotid sheath. Carotid sheath. Okay, chalo, bachcho. So I've told you everything here. Just one moment, let me just see. Chalo, ye bolo pehle. We'll see this MCQ first. Think and answer. Think and answer. These are must know topics, must know MCQ for you children. Very important. Anyone? Anyone? चलो. Okay. D. Hoarseness of voice. और कोई है? Okay. Very good. So all of you are answering it as D. बच्चों, anyone? Any other answer? Anyone? Any other answer? बच्चा ineffective कफ लिखा है एक बच्चे ने. Okay. Madnet has written as A. Okay, most of you have answered this as D, no? But D is not the answer, huh? Bacha, D is not the answer. Why? Understand this. D is not the answer. See, good. You are answering no. So when you answer a wrong option, no, you will always remember this, huh? You'll always remember why it is wrong. वो हमेशा याद रहेगा आपको. I'll start. Have a look, students. Let us start with this very important MCQ. Be very clear about your concepts. I believe in clearing the concepts. All your MCQs will be cleared. Okay, I'll start. A 40-year-old woman complains of swelling in front of the neck. Biopsy revealed a papillary thyroid carcinoma. Fine. She undergoes a hemithyroidectomy. The lesion is removed with clear margins. However, during surgery, a structure lying adjacent to the superior thyroid artery at the upper pole of thyroid is damaged. Bachcho, if you can tell me, there are two arteries which supply the thyroid. Answer this. There are two arteries which supply the thyroid. बोलिए बच्चों बोलिए. Two arteries supplying the thyroid gland. Anyone? Come on, answer this. हाँ, बोलो ना बच्चों बोलो. One is the superior thyroid artery and the other one is the inferior thyroid artery. Very good. अब ये जो superior thyroid artery होगा, this superior thyroid artery comes here, and this superior thyroid artery is a branch of external carotid. The superior thyroid artery gives two branches. One is the anterior branch and one is a posterior branch. The anterior branch runs along the anterior border of the lobe and goes on the superior border of the isthmus. ठीक है बच्चों? The anterior branch of superior thyroid artery runs along the anterior border of the lobe and then goes on the superior border of the isthmus, and it will anastomose with the opposite branch of superior thyroid artery. Okay, and which is this artery? This is the inferior thyroid artery. It gives many branches, and one branch of the inferior thyroid is going to anastomose with the posterior branch of superior thyroid. Posterior branch of superior thyroid artery. Okay, एक मिनट, what is this? This is the inferior thyroid artery. This is the superior thyroid artery. This is the anterior branch, and this is the posterior branch. Okay, right. Now what I want you to understand is, students, this superior thyroid artery accompanies a nerve. What is this nerve? Anyone can tell me. This superior thyroid artery is going to accompany a nerve. Yes, students, come on. Superior thyroid artery accompanies a nerve. This you should know, bachcho. This you have to know. External laryngeal nerve. Very good. So superior thyroid artery accompanies the external laryngeal nerve, and the inferior thyroid artery accompanies the recurrent laryngeal nerve. ठीक है? So superior thyroid artery goes with the external laryngeal. The inferior thyroid artery goes with the recurrent laryngeal nerve. So now when we are cutting the superior thyroid artery, bachcho, when we are cutting the superior thyroid artery, which nerve can be damaged? The external laryngeal nerve can be damaged. And this external laryngeal nerve supplies a muscle. कोई बोल सकता है? What is the external laryngeal nerve supply? Yes, students. What is the external laryngeal nerve supply? Anyone? Come on, come on, come on, बच्चों. What is the external laryngeal nerve supply? एक मसल सप्लाई करता है ये मात्र. Only one muscle it supplies, and this muscle is outside. Yes, very good, very good, very good, very good. And this muscle is outside. It is known as the extrinsic muscle of the larynx. The name of the muscle is, yes, you all answered this, cricothyroid. है ना? Cricothyroid. And what is the action of cricothyroid? Now this you have to know. आप सबको पता है. The external laryngeal nerve supplies the cricothyroid, and this external laryngeal nerve accompanies the superior thyroid artery. So when I'm cutting the superior thyroid artery, the external laryngeal nerve can get damaged. Now what is the external laryngeal nerve supply? Cricothyroid. And what is the action of cricothyroid? It's a tensor of the vocal cords. It's a tensor of the vocal cords. And you know, when the vocal cords are tense, nahi bacha, it's not adduction, it's a tensor of the vocal cords. And when the vocal cords are tensed, you get a very high pitched voice. You get a high pitch voice. ठीक है बच्चों, this is the cricothyroid, tensor of the vocal cords. And when the vocal cords are tensed, we get a very high pitched voice. Fine. So now see the MCQ was what? If the external laryngeal nerve is damaged, which muscle is paralyzed? Cricothyroid. The tensor action of the vocal cords is lost. There will be a voice pitch limitation. There will be a limitation in the pitch of the voice. The person talks in a very low pitched voice. Okay. Person talks in a very low pitched voice, and this is known as huskiness. H-U-S-K-I-N-E-S-S. Huskiness of voice. It is known as huskiness of voice, or it is known as loss of timbre of the voice. It is known as huskiness of voice, or it is known as loss of timbre of the voice. Timbre, T-I-M-B-E-R, loss of timbre of the voice. ठीक है? Is this clear, students, to all of you? Matlab, see, if the superior thyroid artery is damaged, which nerve is also damaged? The external laryngeal nerve. External laryngeal nerve supplies what? Cricothyroid. The action of cricothyroid is tension. It tenses the vocal cords, and when the vocal cords are tensed, we get a high-pitched voice. Now, when this tensor action is lost, the person talks in a very low-pitched voice, and this is what we call as huskiness of voice or loss of timbre of the voice. Loss of timbre of the voice. Right? Clear to all of you? So answer is A for this. Answer is A for this. किसी को doubt है बच्चों? Has anyone any doubt in this? This is a very, very, very important thing, बच्चों. Very important thing. Huh? All of you have answered D. Tell me, hoarseness of voice. Huh? Hoarseness of voice is due to involvement of which nerve? The recurrent laryngeal nerve. Recurrent laryngeal nerve. Hoarseness, recurrent laryngeal nerve. Yes. And tell me, which is the nerve which supplies? ये कौन होगा? Ineffective cough. Which nerve would be that? Yes. Which nerve would be that? Ineffective cough. कोई बोल सकता है? Ineffective cough. मतलब coughing is hampered. Coughing is not there. Which is the nerve which helps us to cough? हाँ, very good, Kirti. See, क्या होता है ना बच्चों? See, when you are eating very fast, lecture है. So you are having your food very fast, and when we have food fast, the food enters into the larynx. अब जैसे food larynx में जाता है, the person starts to cough. Because who's going to supply the larynx above the vocal folds? Internal laryngeal nerve. And so internal laryngeal nerve is going to stimulate the cough reflex. ठीक है? If the internal laryngeal nerve is damaged, there will be ineffective cough. So this is internal laryngeal nerve. Perfect. Very good. समझ में आ रहा है ना ये? हाँ. Yes. And this, tell me this option, shoulder shrug. Weakness of shoulder shrug. Which is a muscle which helps to shrug the shoulders? Shrugging of the shoulders. कौन है ये? Which is the muscle which helps in shrugging of shoulders? बोलो बच्चों. Trapezius. Yes, very good. Trapezius. And what is the nerve supply of trapezius? कोई बोल सकता है? Nerve supply of trapezius. Very good. Kirti, you are answering well. Nerve supply of trapezius. बच्चों, nerve supply कहाँ से? Recurrent laryngeal nerve नहीं है. It's not recurrent laryngeal nerve. बच्चा, nerve to serratus anterior. No, my child. Nerve to serratus anterior will supply what? बच्चा, serratus anterior है ना? Serratus anterior को supply करेगा ये. नाम ही है ना, nerve to serratus anterior. Good. I want you to attempt everything. Attempt karo. Make mistakes here. That's okay. Yes, answer is spinal accessory nerve. The spinal accessory nerve supplies what? Sternocleidomastoid and trapezius. That's spinal accessory. Yes. So weakness of shoulder shrug would be due to damage to spinal accessory nerve. Perfect, बच्चों. Good. Great going. You're doing well. Chalo, I'll just brief you about our platform. Just give me 2-3 minutes. I'll brief you about our platform. Then we come back to our MCQs. Students, here we have a plus subscription in which there are daily live classes and you can access the recorded classes too. Learning from the top educators, live quizzes. You can study from the device of your choice. Access to over 25,000 plus question banks. And students, now we are coming up with printed notes for our 12 months and plus subscription students. Okay, printed notes. And we are starting with a new batch. We are starting with an FMGE lectures from tomorrow. Okay, from today's Monday, from Wednesday, we are starting with the FMGE lectures. If you want, you can register to this course. Okay, I'm starting with anatomy. So, iconic subscription in which you've got the best of Unacademy and pre-bladder. Special class features, students, in which there's an interactive live class, poll for the learners, raise a hand technique. Never miss a class with proper notifications being given, lecture notes, and anytime, anywhere you can access the class and get your doubts solved. A highly effective and curated question banks with some 25,000 plus MCQs have been prepared with detailed explanatory answers, especially for you students. Now boost your medical preparation with 24 months, that's 2 years, you get 4 months of free subscription, and with 12 months, you get 2 months of free subscription. And look students, these are our toppers. They have got very good marks in the recent NEET PG. Similarly, we had very good ranks in the FMGE exams which were held before this. Okay, so congratulations to all of them. And now we're starting with 2 new batches from 20th of October. Target NEET PG 2022. We're starting with clinical case discussion and instrument batches. Download the Unacademy app and subscribe to it. Okay, fine. Chalo students, answer this. What is this pointed structure? I hope you can see the slide. Come on students, what is the slide? Yes, you can answer this, you can crack this MCQ. Identify this pointed structure. Yes, vagus, very good. That's a vagus nerve. How do you identify this as vagus, bachcho? How is this as vagus? What is this? यहाँ पे lung का hilum होगा. Remember, there's a hilum of the lung here. And the nerve, students, the nerve which goes behind the hilum, is vagus nerve. Yes. And the nerve which goes in front of the hilum, can anyone tell me this nerve in front of the hilum? Boliye. Nerve in front of the hilum, this one. What is this? Yes. Longest नहीं है बच्चा, उसका reason is it is behind the hilum. Longest इसमें दिखेगा नहीं ना आपको. So nerve behind the hilum is vagus nerve, and the nerve in front of the hilum is phrenic nerve. Yes, very good, perfect. This you are looking from which side? See, the part of the thorax in which the heart lies is known as what? Mediastinum. The part of the thorax जिसमें heart होता है, that part is known as mediastinum. अब ये कहाँ से देख रहे हो? Where are you looking this from? Are you looking this from the left side or are you looking this from the right side? If you can answer this, कहाँ से देख रहे हो? Yes, students, answer. This mediastinum, I'm looking from which side, left or right? Left. Very good, left. Justify करो. Why left, बच्चों? Why is it left? Yes, students, why is this left? Justify your answer. Bolo. Justify. Why left is right? Aorta is on the left side. Perfect, बच्चा, perfect. Aorta is on the left side. आपको ये aorta दिखता है? This aorta can be seen here, so it's on the left side. Had this been right side, बच्चा, what would you see? अगर ये right side होता, Medley, not because of heart, it's because of the aorta. Had this been right side, क्या दिखता था? I would not see the arch of aorta. I would not see the arch of aorta. What would I see? अगर मैं ये right side से देखता हूँ, what would I see? A vein. I would see a vein which is on the right side. What is that vein? Azygous vein. The vein would be azygous vein. I would see the azygous vein and the SVC. Perfect, bachcha. Very good. I would see the SVC. I would see the azygous vein. Excellent. Very good. And then if you can tell me what is this vein? ये क्या होगा? This is on the left side. Left side पे कौन सी vein होती है? Which is the vein on the left side? Yes, which is the vein on the left side? It's the hemiazygous and the accessory hemiazygous. On the left side would be the hemiazygous and the accessory hemiazygous vein. Very good, students. And what is this? What is this structure? Can anyone answer this? What is this structure? What is this? Come on. Anyone? Sympathetic trunk. Excellent. Very good. That's a sympathetic trunk. Right. That's a sympathetic trunk. Perfect. Okay, if you can answer this MCQ. Chalo, the last MCQ of the day. So I've got one more lecture for you on FMG. Must know MCQs. We'll see this somewhere later. I'll keep this lecture for you. Students, answer this MCQ. Anyone? Upper to anterior. Okay, anyone else? Upper to anterior. Okay, fine. I'll tell you this. Let me answer this. Answer is not upper to anterior. Huh? Upper to anterior nahi hai uska answer. Understand why? Good, you've answered. Good, I'm very happy. Fine, look, a 33-year-old patient suffered from sudden occlusion at the beginning of the descending thoracic aorta. ठीक है, beginning of the descending thoracic पे occlusion हो गया. This condition would most likely decrease blood flow in which of the following intercostal arteries? Following intercostal arteries. Okay. Now tell me, students, just one moment. Give me 2 minutes. 2 minutes. 2 minutes. I'll explain this to you. Right. Branches of the descending thoracic aorta. What are the branches of the descending thoracic aorta? These are the posterior intercostal arteries. So posterior intercostal arteries. हाँ ये जैसे intercostal spaces होती है ना, intercostal spaces. In the intercostal spaces in front there are anterior intercostal arteries, and students, in the intercostal spaces behind are the posterior intercostal arteries. So posterior intercostal arteries in the lower spaces, posterior intercostal arteries in the lower spaces are branches of descending thoracic aorta. Okay, so posterior intercostal arteries in the lower spaces, students, are branches of descending thoracic aorta. This is very important. In the upper two spaces, look, in the upper two spaces, intercostal spaces बोल रहे हैं हम लोग. So in the lower spaces, the posterior intercostal arteries are the branches of descending thoracic aorta. So अगर occlusion होता है in the descending thoracic aorta, which arteries are going to be involved? The lower posterior intercostal arteries below second level, below the second. In the upper two spaces, these are branches of, in the upper two spaces, I'll write it like this: posterior intercostal arteries are branches of superior intercostal artery, which is a branch of costocervical trunk, which is a branch of second part of subclavian artery. It's a branch of second part of subclavian artery. This is perfect and very important. इसका मतलब समझ लो. Just understand the meaning of this. What I want you to understand. So if I draw this descending thoracic aorta for you, ये arch है, ये descending thoracic aorta है. The posterior intercostal arteries in the lower spaces are branches of descending thoracic aorta. In the upper two spaces, these are branches of subclavian artery. Understood, students? Now you will always remember this. है ना? ऐसे याद रखना बच्चों, ऐसे याद रखना. Okay, look here. Once again, I'm answering this. Once again, I'm telling you this. Listen. Easy है. Don't get confused. It's not so difficult. Look, ये ना intercostal spaces होते हैं बच्चों. Intercostal spaces are there. What are intercostal spaces? The spaces between the ribs, है ना? The spaces between the ribs are known as intercostal spaces. Perfect. Right. So there will be arteries, intercostal spaces आगे होंगे. These are the anterior intercostal spaces, and intercostal spaces are behind posterior intercostal spaces. Fine. So the posterior intercostal spaces में होंगे posterior intercostal arteries. And students, the posterior intercostal arteries in the lower spaces, are branches of the descending thoracic aorta. In the upper two spaces, these are branches of the superior intercostal artery, which is a branch of costo-cervical trunk, which is a branch of second part of subclavian artery. You know students, this subclavian artery is divided into three parts by whom? ये जो subclavian artery है ना, इसके तीन parts होते हैं. It is divided into three parts. By which muscle? Can you tell me? Subclavian artery is divided into three parts. By which muscle? Anyone? Yes, students, subclavian artery is divided into three parts. By which muscle? Scalenus anterior. Very good. Subclavian artery is divided into three parts by scalenus anterior, right? So that's the first part, that's the second part, and that's the third part. So where is the second part of subclavian artery? Students, समझ लो ये, understand this. Where is the second part of subclavian artery? Behind the scalenus anterior. Scalenus के anterior के पीछे is the second part of subclavian artery. From the second part of subclavian artery, we get a branch. Name the costo-cervical trunk. The costo-cervical trunk gives a branch. Name the superior intercostal artery. And the superior intercostal artery gives what? The posterior intercostal arteries in the upper two spaces. Posterior intercostal arteries in the upper two spaces. I hope this is clear to all of you. Koi doubt? If anyone has got any doubts, you please tell me. Students, any doubts anyone has, you tell me. Got it, no? Perfect. Very good. You tell me, वैसे जैसे subclavian artery is divided into three parts by the scalenus anterior, any other artery divided into similar three parts? Any other artery divided into similar three parts? Yes, students, बोलो. जैसे subclavian artery is divided into three parts by scalenus anterior, any other artery which is divided into similar three parts? One, axillary artery. बच्चों, axillary artery is divided into three parts by whom? बोल सकते हो? Axillary artery is divided into three parts by whom? Which muscle? Axillary artery is divided into three parts by pectoralis minor. Perfect. Very good. Axillary artery divided into three parts by the pectoralis minor. The subclavian, the maxillary artery. I'm so sorry. The maxillary artery. एक subclavian हो गया by scalenus anterior. Axillary artery by pectoralis minor. The maxillary artery is divided into three parts by a muscle. Maxillary artery divided into three parts by anyone? बोल सकते हो? Maxillary artery is divided into three parts by which muscle? बोलो. Maxillary artery is divided into three parts by lateral pterygoid. The maxillary artery is divided into three parts. Yes, very good, Alpika. Very good. Lateral pterygoid. So just remember this, subclavian by scalenus anterior, axillary by pectoralis minor, and the maxillary artery is divided into three parts by lateral pterygoid muscle. Lateral pterygoid. Perfect. ये clear है ना? This is clear. So answer for this is lower posterior. Lower posterior. Not all posterior, wrong. Upper two anterior, wrong. So it is lower posterior. Anterior intercostal arteries are branches of internal thoracic artery. We'll see this later. I'll tell you this later somewhere. Anterior intercostal arteries are branches of internal thoracic artery. Internal thoracic. Fine students, I hope this is clear to you. I enjoyed this lecture teaching you, and it is a very interactive lecture. It was a very interactive. Okay, the more you interact, bacho, the more I can tell you. Understand? So I know the more you interact, the more it is easy for you to understand, the more it is easy for me to teach. Okay. So see you next time once again with such must-know series of MCQs, especially for you children. Thank you. Thank you. And God bless you. Thank you. Thank you. Thank you to all of you. Thank you.